Welcome. It's nice to see all of you tonight. And again, thanks for coming out on this blustery November. So, what is it that we do here at New York Medical College? Well, we have some guiding principles. Our goal here in the Department of Speech Language Pathology is really to fill an expanding role in healthcare and other settings. Speech language pathologists have the luxury, really, of being able to practice in a number of different settings. Our focus here is largely in the area of medical speech language pathology. We feel like we meet a need that isn't met in many other programs, but you don't have to necessarily go out and practice in medical speech language pathology if that's not really what you're interested in doing. The program that we offer here really gives you the underpinnings to practice in any area of speech language pathology that you are interested in, right? And our belief is that you need the science and you need the neuroscience, you need the anatomy to understand the mechanisms of speech and language and swallowing in order to do any job in any setting as a speech language pathologist. We are advocates for people with communication and swallowing disorders and their families, and we're here to address the healthcare needs of a diverse population. We also value and try to instill in our students and graduates lifelong learning. So you come to school, you learn what you need to do to go out and get a job, but there's always new things out there to learn and explore. We train students to work with individuals whose communication or swallowing deficit is part of more complex congenital, developmental, medical disorder, or traumatic injury. We feel like we have a lot of strengths here at New York Medical College. One is in our medically focused area, we provide a whole anatomy. So you are in the lab in your second semester here. It's a semester-long course. You work in teams. You have a cadaver. You dissect that cadaver. You are looking specifically at the head, the neck, the lungs, right? All of those components that are important to speech, language, and swallowing. We also have a neuroscience sequence here. Teaches our neuroscience course. But in addition, we have specific courses, clinical courses that focus on identification of people and treatment of individuals who have neurological, okay? Both in the pediatric area and in the adult area. We embrace technology here. So Dr. McHenry spends a lot of time teaching how to use instrumentation. Dr. teaches you how to do video fluoroscopic studies of swallowing. I spend time with you teaching you augmentative and alternative communication equipment, right? So these are the tools that we use in the field and have those things available to you as students. We have what we think is a pretty unique diagnostic sequence where we bring you in a little bit early in your first semester, and we have a clinical skills readiness series, right? Because we have you in the clinic your first semester. So we bring you in and we spend 3 weeks working on what do you need to be able to do when your patient walks into the clinic on day one, and you're going to be that clinician working with that patient. So we have this clinical readiness series that we focus on skills needed for diagnostics and intervention practices in an outpatient setting here. And the other thing that we offer in the first year of the program down at New York Presbyterian Brooklyn Methodist Hospital is a diagnostic rotation where students go 4 to 5 Fridays, and you spend time with the clinic learning about hospital speech language pathology. All right, so you're doing some bedside cognitive evals, some clinical swallowing studies at bedside, and Dr. Raquelme will speak a little bit about that in a few minutes. This just shows what happens in our anatomy lab. Students progress in this program as a cohort, right? You start together, you end together. You share the joy, you share the misery. No, 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 no. It's all joyful, right? It's hard work. And we will be upfront with you from the beginning, right? It's hard. Students, right? Yeah. Okay, but they're here, right? And I'm hoping that they've been to talk to you about how they've been able to translate some of the work that they've done so far as they are now out in their external placements, right? So some of the what we feel are cutting edge things here at New York Medical College are an optional elective in research. We don't require, you have a research methods course, you learn how to source literature so that you can make evidence-based decisions as a clinician, okay? In addition to that, so everybody gets that. In addition, you have the opportunity to engage in research with a faculty member if that's something that you're interested in, okay? The other thing that we offer is, again, our 3-week clinical readiness series to get you in the clinic and understanding what it is that you're doing in the clinic, and you're fully supported. So one of the other, I think, important things to understand about this program, when you're here your first 2 semesters, you are provided with 100% supervision for your clinical treatment cases and your clinical diagnostics, okay? So you have a clinical educator who is assigned to you in this one-on-one relationship, okay? So you don't have a clinical supervisor who's supervising 3 or 4 people at the same time, right? So that person will have a good understanding of what you're doing and will be able to counsel you or after the session or later when you have a meeting about that session, and really be able to speak about what happened during the entire session versus the little snippet that they saw when they were observing. So we think that's an important component in your clinical training. We offer 5 semesters of clinical practicum here. 2 are in-house, and then we have 3 external rotations, and Professor Kaiser will be speaking about those experiences later. One of the other things we have is an overseas clinical practicum. Dr. Raquelme will be, he's in charge of that, and we'll be speaking of that when he's up here talking to you. I think one of the other important features of this program is provides mentored clinical writing, okay? So she reads every report that you write, and she provides feedback. Clinical writing is not an easy task to learn how to do, okay? It's a very different writing style than what you're used to writing, okay? So we provide a lot of support in terms of making you good writers for a clinical environment. Program strengths. Well, these people over here are really the strength of this program, right? I get the pleasure of coming to work every day and working with a group of individuals who are committed to the discipline of speech-language pathology, committed to teaching the next generation good practices, ethical practices in speech-language pathology. We all share a common goal in making sure that we are training and graduating clinicians who are qualified to meet the healthcare needs of individuals with communication and swallowing disorders. We have certain requirements that we need to ensure that graduates attain while they're here. One is making sure that you have 400 or more clinical clock hours as a practitioner. And we have to span the depth and the breadth of the discipline. So we're providing you with pediatric experiences. We're providing you with adult experiences. And we have a program that has a very rich base of opportunities to ensure that you are getting experiences across the lifespan and experiences across the discipline. Our graduates, where do they go? Well, students get jobs, parents, that's a good thing, right? And we have some of our students going into acute care hospitals. Some of our students are going into rehabilitation settings, nursing homes, outpatient rehabilitation settings. Some go into private practice settings. Some of our graduates go into school settings. Some of our students have gone on to fellowships, graduate school, PhD programs. So they go out and practice for a little while, and then they move on educationally. We've had recently one student who had a public health fellowship at the National Children's Hospital in Washington, D.C., and another student who was a clinical fellow in a program at the Cleveland Clinic. So who do we treat as speech language pathologists? You see that we treat a lot of different disorders, right? Spanning pediatrics and adults, right? In the areas of speech sound disorder, language disorder, swallowing disorders. We have a curriculum that covers all of this information, all right? We have no electives in this program, except for the overseas elective and the research elective. But in terms of core content in the discipline, everyone takes every course. Because we were scratching our heads thinking, well, what could be an elective? What does somebody maybe not need to know? Well, we decided that everybody needs to know everything. So that's kind of how we developed this program. It's just a shot of our clinic area, a poster presentation. We had some students presenting at a conference, and therapy. So who are we? Well, I'm Kate Franklin. I serve as the department chair here and associate professor in the program. My areas of interest are in augmentative and alternative communication, so I teach that course, and I do some practice work in the clinic in that area. I also participate in the diagnostics and clinical processes course that we run here, and stay pretty involved in aspects of decision-making regarding clinical training for students. And Kathleen Kaiser is going to come now and talk about what some of those other activities are in clinical education.
Good evening, everyone, and welcome. I am Kathleen Kaiser. I'm the Director of Clinical Education here in the Department of Speech and Language Pathology. You are in clinic for 5 semesters. It is a really well-rounded experience that we will provide you over those 5 semesters. Dr. Franklin spoke on the left side of the screen there, Boston Children's Health Physician. We are their division of speech and language pathology. So if those physicians need to make a referral to a speech and language pathologist, we get that referral. We do, in first and second semester, put you into a rotation that consists of outpatient diagnostics. It's primarily speech and language evaluations that you'll do in your first year. Occasionally, we'll have you do some of our pediatric feeding evaluations. And then you will be, that will happen in a team. You'll have a partner for your actual evaluation session, and you'll be part of a diagnostic group that meets weekly and plans and learns and all of that. You will have your own client, at least one, most likely a speech and language pediatric client. You may work with some of our adults. It will be 100% supervised by your clinical educator. You will see that patient weekly for the first semester. And then second semester, we'll switch it up and you'll have a different client in a similar setup. So you'll do that outpatient diagnostic rotation and the outpatient treatment. We spoke a bit about the that middle column, the New York Presbyterian Brooklyn Methodist Hospital rotation. That is your diagnostic practicum. You learn the the basics of what it's like to work in a hospital, which is really wonderful. So that when you come to your externships and you're going to a hospital for a full externship, you've actually been in a hospital before. So you have those basics that you can, come in with and grow from there, which is really phenomenal. That doesn't happen in many programs. In your second semester, over to the right hand of the screen, we do some preschool slash community screenings. Professor Valella will take you out on a Friday to a preschool, and you will be working with children in those preschools to decide, are they typically developing? And if not, maybe they need a full evaluation, and you would be making that referral. It's a really great experience to fine tune your diagnostic skills and also see what typical development is supposed to look like. So that's a really nice experience. So after semesters 1 and 2, you're ready for your externships. We have worked really hard to develop our externship sequence. We basically divide the class out into thirds, and you will do one of these clinical externships that I'm going to speak about each semester: summer, fall, spring, in no particular order. It just depends on what's available and which group you're in, and things like that. So everybody gets to do all 3 of these clinical externships. You will have a clinical externship in a school. We do that, one, because we want to make sure that our students get the full experience of SLP over the lifespan, and certainly being in school is a big part of lifespan. But the other thing is we make sure that all of our students are eligible for the TSSLD certification. That is the certification for a speech pathologist to work in a public school in New York State. You may or may not decide to go ahead and pursue that certification, but all of our students who graduate are eligible for that certification. And part of what that means is you need to have a placement in a school. So we have lots of schools to send you: preschools, schools for special needs, public schools. So we work with you about what seems to be best to fill in your clinical experiences. Another option, you may be in a healthcare setting. So you may be in a hospital, you may be in a rehab center, you may be in an outpatient clinic, something of that sort. And again, we have lots and lots of clinical affiliations, and we do work very closely with our students to understand what their needs are, what their interests are, what their abilities are, to make sure that those clinical externships are positive experiences for y'all. And then the third option, which we're really excited about, really unique to our program, we're calling it the modular rotation for medically based competencies. So what does that mean? What that means is we are very fortunate to have our campus here sharing the environment with a major medical center, and we have relationships over there. We have certainly that relationship with New York Presbyterian Brooklyn Methodist, and we also have a relationship with St. Mary's Children's Hospital in Queens. So looking at all the things that happen in all of those environments, we put together a rotation where you would rotate through different departments in each of those hospitals that I mentioned. So we have them in competency-based modules. So you will have a module, for example, in, let's say, pediatric augmentative communication. And you will go down to St. Mary's and you will work with the children, medically fragile children, doing some augmentative assistive technology kinds of things with those children for a number of weeks, maybe 6 Thursday mornings. You'll achieve those competencies, and the following Thursday morning, you may be here on campus in the Behavioral Health Center working with children in the inpatient psychiatric facilities that we have here. Or you may be working with adults doing cognitive linguistic screenings. So you're getting the idea that we have these competencies that we would like everyone to graduate with, that we make sure that we provide you with these kind of mini modules over the course of a semester where you will graduate with a really wide variety of experiences that you probably would not have gotten if you hadn't been in this modular rotation. You may have gotten some of them somewhere, but to be able to put all of these into one semester is really quite unique, and we're really proud of that. Okay, and we do all this because we need you to be really great clinicians. We don't have a cookbook to say, here's how you do speech pathology. We immerse you in the academics, all of the foundational information, and then we put you in a wide variety of hands-on experiences that you'll come out really very well prepared for what it is that you're going to need to do as an SLP.
So how does that translate? It translates into our students achieving a pass rate of 100% on the national praxis examination in speech language pathology. So we have quite a good track record with our students, not just passing, but passing at a high level. Employment is an parents, your child will get a job. So that's a great thing to know, right? So what we know about speech language pathology is that it is a much faster than average growing profession, right? So you can take a look at that in your free time. Our program is accredited by the Council on Academic Accreditation of the American Speech Language and Hearing Association. What does that mean? It means that as you're looking at graduate programs, you need to make sure that you are applying to a program that is accredited by the Council on Academic Accreditation, right? Call it the CAA. What that accreditation means is that the program meets a certain set of standards. I won't go into what those standards are, but it's about the curriculum, the clinical placements, it's about your faculty, it's about how students are treated, it's about outcomes data, it's a whole bunch of things that go into making a program an accredited program. So we are an accredited program, and we actually just had our accreditation site visit for the next cycle 2 weeks ago. Yeah, and it was very successful. So we're proud about that. But our last accreditation was in 2011. And our site visit chair actually sent us this quote. She said, "I'm so pleased," and they had a trainee for the visit, that our trainee got to experience a visit at a program that meets or exceeds the standards in nearly every way. Now, they now have a frame of reference for excellence. So we're really proud of that statement, and we believe that we are continuing to meet all of those benchmarks and are actually innovating even more. So the fact that we developed the modular rotation, that was one thing that our site visitors were, ooh, that's amazing, right? So they liked seeing the innovations that we are employing here. So we're a 5-day-a-week program. We have, for the first 4 semesters, coursework usually runs 2 days a week. Is that right? Yeah. So usually a Monday, Wednesday schedule for coursework, except in the second semester when you have anatomy on Tuesday and Thursday. The other days are organized for clinical purposes, and you may have a diagnostic on one day, you may be observing a diagnostic another day, you may be engaged in working with your patient on another day, You may be out in the community doing a screening. So we keep those other days pretty fluid, so, but the expectation is that you're available on those days. Yeah. But so, and coursework happens across all 5 semesters.
One of the most important people I think you need to hear from is a recent graduate. So she can give you her experience. Carolyn Vecchio, you saw her in our video earlier. She graduated from our speech language program last May. She was actually our valedictorian, so we were very proud of her. She spoke at Carnegie Hall. And
wait. Valedictorian, speech language pathology graduate in a medical school. I'm just saying. Just remember that.
Thank you. And Carolyn, you can explain a little bit more about your experience now. She's actually a fellow in our clinic here, so she just rushed here from seeing clients, so she can speak with them.
So that's why I'm a little bit behind, and I obviously haven't heard all of what the professors have told you, so forgive me if I repeat anything, but I had to make sure I was here to speak with you all because I feel so strongly and passionately about this program that I felt it was really important for me to be able to speak with you. So as they said, I'm a recent graduate. I cannot say enough about this program. I originally was a biology major. I found my way to speech pathology. What I loved primarily about this program, which sets it apart from other programs, is the medically oriented focus that it has. That to me, whether you're interested in a medical field or not, gives you a core foundational knowledge that's way, way more comprehensive than you would get at other places because of the medical background. So they really make sure that you understand those concrete concepts very early on. And then you add in all the other speech pathology courses on top of that, but because you have that core foundational knowledge, you understand them that much more. So that's one of the real big assets for this program that I think is a huge selling point. But I think more so than that, it just really makes me, as a recent graduate, feel so confident in the knowledge that I know. And I think ultimately that's one of your most important things. But at the end of these 2 years, you're going to be a practicing clinician after your clinical fellowship. So right now, I spent my 2 years in this program. I graduated in May. I passed my national board exam. And then now you have to do a 9-month clinical fellowship. So I'm fortunate enough to be here in our clinic. It's an affiliate of Boston Children's Health Physicians. And I am working with population basically ages 2 to 3 all the way up to adults. So I have a really widespread age population as well as different speech and language difficulties that the individuals have. So that's what I'm here doing now. You'll be working in that clinic your first year, which is phenomenal. I'm a very hands-on learner. I don't know about anybody else, but to be able to be in classes and at the same time, your very first semester, you're working with a patient, obviously with a practice and experience speech language pathologist with you, but having that hands-on knowledge is irreplaceable and really lets you apply the knowledge you're learning in class, but with a patient right in front of you. So that's really phenomenal. And you have that your first semester. Obviously, you get more patients your second semester. And then you are out in the community in different organizations working on your externships. So for me, my first externship, I was at a more of a critically ill, medically fragile pediatric population hospital. It's called St. Mary's Hospital for Children. I thoroughly enjoyed that experience. And so my second placement was actually at Hawthorne Country Day School, which is a private school for individuals with special needs. I worked with individuals that had autism, primarily on the more severe side of the spectrum. Again, another experience that I loved. And then, like they talked about, the modular experience. So as you kind of see for me, my experiences were very varied. I came in with, I want to work in a medical field. That's exactly what I want. And I fell in love with also working with schools. So it's kind of, for me, I think it kind of speaks to how they place you in your placements. They really work with you. They kind of know what areas you're interested in, but also, you know what, maybe you should branch out and kind of see. And for that reason, I fell in love with all different settings. So I think it really speaks to the effort and time that they put into this program, and they put into making sure you have those great externship experiences that allow you those opportunities to learn. And then in the classroom, I cannot say enough about the professors. Truly, they are the best professors I've had in my educational career. I look up and admire to each and every one of them for various reasons. And I just really think that they're obviously a huge part of who I am today and the clinician I am today, because they gave me that valuable knowledge. And it wasn't just in the classroom. I would leave and ask them questions and knock on their door, and they were always open to answering my questions and helping me along the way. So I hope that was, I know it was a lot to throw at you. I will be here afterward. I'll stay for as long as you need and answer as many questions. I just really, truly feel so strongly about this program, and I want you guys to have the opportunity just to know more about it. I know, I mean, you've been here, I'm sure, for 2 hours now, so I'm sure your mind is filled with knowledge. But I would be happy to speak with any of you and provide my contact information for further questions. It just really is a program that is, I don't know if I can say this, but far above many other programs, just because of the comprehensive knowledge that you're getting. And I think, as for me, leaving this program, I felt very confident when I went out to my externships. Now in my clinical fellowship, I feel very, very confident in what I know, and that to me was one of the most important things. If I'm going to be working with a patient and having those clinical experiences, I wanted to feel confident in the knowledge that I had. So, and I thank New York Medical College for that. So, yeah. You're welcome.
So that concludes our formal portion of the evening. There is definitely coffee and food still out there, so feel free to grab anything you want. Our students will be around, our faculty will be around, so if anybody has any more questions, feel free to ask us. And if you have any admissions-related questions, please contact our office and we'll be happy to help you. Thanks for coming.